Everyone, welcome back to my YouTube channel. In this video we will discuss about functional performance and 6-minute walk test. Because the physiological data is not always directly tied to functional performance, as in the case of the left ventricular ejection fraction. It is also important to consider the functional performance outcome measure in the patient and program assessment. There are many outcome measures available for the examination of the functional performance and gains in the aerobic capacity in the cardiovascular and pulmonary patient population. Also, the gold standard for measurement of the functional exercise capacity is a measurement of the volume oxygen consumption. Many therapists will not have the access to have the equipment needed to make the VO2 maximum measurement to their day-to-day treatment environment. Fortunately, there are many other reliable and valid measures available to evaluate the functional performance and outcomes that can be used in the home, outpatient, inpatient, acute rehabilitation, and other treatment environments. A summary of some of these measurements include the self-paced walk test, the 2, 3, 6, and 12-minute walk test, the modified shuffle test, treadmill endurance test, and 200-meter walk fast test. Also, the extended explanation for each of these measures is beyond the scope of this chapter. Reference for those functional outcome measures can be found in the table 22.4. This chapter highlights the two measures most often used in the research and program outcome assessment: 6 MWT and the modified shuffle test, and provide the information and direction you need to perform these tests with your patient population. The 4 walk test most commonly used in the physical therapy environment for assessment of the self-paced functional performance and exercise capacity in the cardiovascular and pulmonary patient population are the 2 MWT, 3 MWT, 6 MWT, 12 MWT. These tests are often used in the research, with the 6 MWT most recently validated among the patient following heart transplantation and the patient with the cardiac pacemaker, obese patient, post-stroke patient, and children with the cerebral palsy. In addition to the 6 MWT, show a high retest reliability among the individual with the chronic heart and the lung disease, heart failure, COPD, fibromyalgia, the elderly, and PAD, and the moderate to high validity when compared to the shuttle walk test, cycle ergometry, physical activity measured with an accelerometer, self-rating on the walking ability, and the functional status questionnaire scores. Each of these tests originally derived from the 12 MWT measure the distance that a patient can walk on a set course at a self-chosen pace in the world time allotted. Now we will talk about the 6-minute walk test. The equipment required for the performance of the 6-minute walk test is minimal. To effectively perform the test, the examiner need a 100-foot halfway marked by 2 cones, a straight path with a 50-foot interval, a clipboard, lap counter, time chair, vital sign monitor, box scale, oxygen score, and access to emergency assistance as needed. Close monitoring of SpO2 is vital among the patient with the pulmonary and cardiac dysfunction to maintain safety during test period. The use of the treadmill on the circle track for the test is not recommended. The course should include a 100-foot track that can be marked at the end with those 2 cones on which the patient walk down and back in the straight line pattern. Patient preparation including the following: patient should be comfortable clothing and the shoes. The patient should use their normal everyday assistant device, for example walker, rolling walker, or cane during the test. And then we will talk about that the patient is normal, a medical regime should be continued. Patient should not have exercised rigorously within the 2 hours of the exam. Instruction provided to the patient are very explicitly outlined by the American Thoracic Society and found in the table 22.5 as is shown here. So guys, today our topic of discussion was very important. We talk about the walk test with different minutes. So if you have any query, you can ask me in the comment section. Thank you so much for liking and watching the video. Keep supporting, keep watching. Thank you so much.